Does clinical outcome of birch pollen immunotherapy relate to induction of blocking antibodies preventing Ig from allergen binding? A pilot study monitoring responses during first year of 8. Via latest results for clinical and translational allergy. Abstract. Background. The clinical benefit of allergen-specific immunotherapy, AIT, involves induction of blocking antibodies. It is not clear if these antibodies function via steric hindrance alone or a combination of levels, avidities, and epitope specificities, and clinical outcome cannot be predicted. We aim to in-depth characterize serum antibody profiles during birch pollen 8, investigate therapy-induced antibodies for their capacity to block Ig binding to BET-V1 and correlate data with clinical outcomes. Methods. Immune responses of 5 birch pollen allergic patients were monitored during the first year of 8 by nasal provocation tests, NPTs, immunocap, immunoblots, direct and avidity enzyme-linked immunosorbent assays, mediator release assays, facilitated antigen binding, FAB, assays, and inhibition mediator release assays. Results. There was no correlation between NPT results and therapy-induced changes in levels, Ig, Im, avidities, or mediator release potency of BET-V1 specific antibodies. In FAB assays, blocking antibodies initiated upon 8 were shown to prevent formation of BET-V1 Ig complexes of an indicator serum pool and significantly correlated with clinical readout. Inhibition mediator release assays using patient-specific Ig for passive sensitization revealed therapy-induced blocking capacities with very good correlation to NPT results. Notably, this assay was the only one to detect a non-responder during treatment in this pilot study. Conclusions. Clinical outcome of 8 depends on induction of blocking antibodies able to prevent the patient's own Ig from allergen binding. Monitoring of clinical efficacy seems to be best achieved using the inhibition mediator release assay, as development of relevant blocking antibodies can be verified in a patient-tailored manner.